Should be fine. Okay, so thank you everybody for coming. I'm Dan Katz from the University of Illinois. This is one of a series of talks we're trying to do within US-RSE to introduce research software engineers to important members of the funding community, and also to introduce the funders to the RSE community, and to try to help everybody learn a bit and to start discussions when they make sense as well, to explore any topics that come up. So today we are happy to have 4 speakers from the National Institutes of Health. Susan Gregurick, Ishwar, Heidi, and Lori. And I will turn it over to whichever one of you wants to start. And I will, I guess, ask, if you don't mind, maybe you can just introduce yourselves briefly as you start.
That sounds great. Thanks so much, Dan, for the invitation to speak to you today. We're super thrilled to be here because we have some exciting news for the research software engineering community and the open software community writ large. I'm Susan Gregurick. I'm the Associate Director of Data Science here at the National Institutes of Health, and I'm joined by my colleagues, and I'm going to let them introduce themselves, starting with my colleague Ishwar. Please introduce yourself.
Hi, I'm Ishwar Chandramalishwaran, a program director in the Office of Data Science Strategy, working with Susan, and my portfolio focused primarily on fair data resources over there, and passing on to Heidi, my colleague.
Hi, I'm Heidi Sophia. I'm a program officer at NIHGRI, which is the Genome Institute, National Human Genome Research Institute at NIH. My portfolio is in informatics and data sharing. Lori?
Good afternoon, everyone. My name is Lori Scott Sheldon, and I'm the Chief of Data Science and Emerging Methodologies in the Division of AIDS Research at the National Institute of Mental Health. And I focus on a variety of activities, everything from data sharing to computational psychiatry, et cetera. So it's really great to be here. Thanks.
Thanks. And these are the folks that you want to know here at NIH, because they lead a much larger NIH working group on software and software sustainability. That working group came up with the foundations of open software that you're going to hear about today. So do jot down their names and connect with them. We want to introduce you as a funder of biomedical and behavioral research, what we have available for the community in terms of funding opportunities, and also introduce to you our strategic plan for data science, which will be refreshed this year. We'll share some relevant programs and potential funding opportunities, but mostly we want to engage you, our software engineering community, to work with us across NIH and to learn from you your needs and your perspectives as we start to develop programs that would be most interesting to you. So our next slide tells you just a little bit about the National Institutes of Health. We are 27 institutes, centers, and offices. You'll see most of them listed here on the top under the Office of the Director. Both Ishwar and I sit in the Office of the Director under the Coordinating Office. Most of these offices and centers do fund research in the community, except for the 3 black boxes down there at the bottom: the Clinical Center, our Information Center, and our Center for Scientific Review. I don't know if you realize this, but we fund over $180 million in software just this last fiscal year, FY22. That's over 400 projects, from R01 grants to very large centers to contracts and to other transactional authorities. So our footprint in software is much bigger than what you might expect, but it's diffuse. It's funded across these 27 institutes and centers, from genome, from mental health, from cancer, from AIDS, and other institutes. The next slide tells you a little bit about where we sit. Ishwar and I both sit in the Division of Program Coordination, Planning, and Strategic Initiatives. All of these little blue boxes are offices in the Office of the Director, Deep Poughkeepsie office. All of us have the same mission: coordinate across NIH in very particular areas. Could be AIDS, could be women's health. Here we focus on data science. That includes artificial intelligence and computing, and new and emerging areas such as quantum computing. So we do a lot of coordination across the institutes and centers, and hence the working group on software sustainability. The next slide is our logo for our office, and you can find more information about us. Shameless plug, datascience.nih.gov. Our goals: modernize, integrated, and fair biomedical data ecosystem. We do this in a number of ways. We fund data infrastructure. Mostly this is in cloud computing. We fund FAIR software and FAIR data and data repositories, and that is all led out of my office by Ishwar. We do a number of activities in workforce development, and FYI, our Data Scholars program has just issued its new FY24 calls for scholars. This is a similar program to the NSF IPA program. You come to NIH for 1 or 2 years as a sabbatical, or if you're from industry, you come as an FTE employee and work on grand challenging problems in data science and artificial intelligence across all of our institutes. So our next slide tells you a little bit about our strategic plan as illustrated here. There are a number of activities. We won't talk about it, data infrastructure. We won't talk about creating and maximizing repositories to enhance our data management and sharing policy, nor our workforce development, nor our sustainability efforts. We're going to focus on data management, analytics, and tools, ways to support generalized, accessible, and usable tools, and to broaden the utility and access of specialized tools. So we're really going to focus on software and analytics today, but you can ask us questions on any number of topics. Most of us are very aware of what's happening across NIH in activities that support the data management and sharing policy, as well as our strategic plan. We work with over 130 colleagues from across the 27 institutes and centers. So it's a very large number of people who are supporting data science at NIH, and it has grown considerably in the past 3 years. The next slide is just some of the details of the activities that we are doing that align with our strategic plan across NIH. Our partnership with NSF, for example, in Smart Connected Health, that really does accelerate innovations in computer science and engineering to support health and medicine. You'll hear from my colleagues about our enhancements of softwares and tools through administrative supplements. That was a pilot that now grows into a much larger program. And we also are very happy to be a part of RDA and a part of RISA, and to support the FAIR for research software, as well as developing best practices for software sharing. So you can learn more about all of our work in software through our website and today. So the next slide is just a little bit of a deep dive, because I suspect that many of you are interested in NSF. We have a number of partnerships with NSF. Some of them are new, like we're partnering with NSF on the Open Knowledge Network. Really excited about that. But we've had a long-standing partnership on Smart and Connected Health. And the goal, and this is an NSF-run program, we are their partner, but they are the lead. Our goal for this program is to accelerate and integrate computer and information science and engineering to support our missions in health and medicine. So the next slide tells you a little bit about what the focus of this program has been for the past 3 years. But please note that this program is being refreshed by NSF. And so our areas of interest may change. But in the past 3 years, we've been interested in data management, interoperability, both distributed and federated data infrastructures. We've been really interested in the fusion and analysis of multi-level and multi-scale data, as well as new multimodal sensing activities and analytics. Personalized medicine is a priority for NIH, and so ways of looking at personalized modes of health that integrate sensing and sensor technology has been an interest. I think it will continue to be an interest. We're also interested in the interoperability of devices and systems that do connect data with devices. So this is a mobile health technology thrust. You'll see this expanded, as well as an aim into robotics. Medical imaging interpretation has been a big thrust for the Cancer Institute. And lastly, we are committed at NIH to understanding health inequities and utilizing social determinants of health to drive data-driven or mathematical models. And so you'll see much more emphasis on this area in the future. Our next slide is just sort of a snapshot of what's been funded at a very high level from the past 2 years. We are now in FY23. This will be the 3rd year of this program. You'll see that some of the institutes support this program with a large number of applications, the Aging Institute, for example, but many institutes do take an application or two. And the areas of science that have been most of interest to the community include artificial intelligence and, of course, those sensors and wearable devices. But you'll see new programs in clinical and electronic healthcare record work. You can see all of the awardees and their projects from our website. And if you're interested in this program, it's worth looking at what has been funded in the past. So the next slide. I think I kick it off to Heidi, correct?
Yes, thank you.
Okay, great. I'm on task. Thanks,
Great.
Heidi, to you.
So I'm going to tell you about a second major activity under Goal 3 of the Strategic Plan for Data Science, which is focused on software and tools. And this activity is basically a series of supplements. So it's a particular kind of grant mechanism where you are able to add funds to a grant, an existing NIH grant. And the goal of this is to really enable kind of a shift in the practice, because with NIH having a very strong research focus, sometimes it's hard to find the funding or the support to really go back and make the software robust, to enhance the software, to update a tool may be extremely successful, but it can be a little bit challenging to actually bring in a lot of the values of good software engineering. So we've run this program for a few years, and the target is to enhance software tools for open science. And some aspects of this that are key to the program are to encourage new collaborations. So to get people to work together who may not have worked together much before, and that includes the biomedical researchers and the clinical scientists, but working with the software engineers, so providing some support to make that possible. And with the overall goal of really enhancing long-term reliability and sustainability of these important tools for biomedical research in across multiple computing environments, in new computing environments, really being able to bring them forwards and make them valuable in modern computing systems. So I'll also mention briefly here this idea of communities of practice. And so there is this document that we all developed together on best practices for sharing software. And I think we'd be especially interested in your feedback on this and your input on this. What perhaps should be added to that? How can that be brought forwards? Next slide. So as I said, we've supported this program for 3 years in the past, but this year it's also available, and this will be the last year. So the opportunity is still open. The due date is March 9th, so it's soon, but the opportunity is still open for one final round of software supplements. The notice number, if you want to look at this in more detail, is there in the box. It's notice OD-23-073. So you can find that by Googling it and see all the details that you might need to consider applying or to understand what this opportunity is. So just in summary, last year, we funded about $7 million in 29 supplements across 13 of the 24 ICs that fund grants with this goal of enhancing software tools with best practices engineering for open science and use in the cloud. But overall, currently, we've funded almost 100 supplements across the 3 previous years, reaching across 19 ICs, which are listed, which you can find below, for this investment to really put high-value software on the same footing, to create a strong footing and foundation for sustainability. So the whole point of this program really is to bring software engineers into the biomedical and behavioral research enterprise and support that in ways that have been challenging in the past, but that we know for sure is going to be very important for our success going forwards in the future. Next slide. So here's just some examples, a high-level summary of the roughly 100 supplements that we've funded so far, just to give you an idea of the kinds of things that we've done. So going clockwise, starting from the upper left, so efforts in data standardization, so a tool called Campfire that maps clinical data models to FHIR and harmonize it to help harmonize EHRs, that was funded to an NCATS grant. In the middle, so software engineering to make toolkits cloud native. So funded to Gabor Marth for the Rufus toolkit that determines genomic structural variation, funded to NHGRI or Human Genome. Top right, scaling fair data systems on the cloud. So achieving greater scalability that's needed with the growing amount of data, funded to the face-based platform to NIDCR. Bottom right, migrating this common problem for us where you have a highly successful desktop application and the application is almost trapped by its own success because nobody can envision giving up what they already have. It's so useful and so embedded in the research enterprise, but then it's not truly scalable. The model is breaking, and it's very difficult to move out of that. So one strategy for that is a migration pattern from the desktop to microservices, kind of a gradual migration. And this is actually a software engineering paradigm. This was awarded to Mark Musin for the Protege ontology desktop to enable this evolution to the cloud, funded to his NLM grant, National Library of Medicine. So the bottom left, another very common problem, extracting data from many different sources, but then sharing the data on the cloud and facilitating that and making that work much more effectively. That was awarded through a brain-computer interface software platform to collect and share severe speech defect data using the cloud, and that was awarded to NIDCD. And then finally, in the middle, a group that did very innovative outreach. Their software platform was multi-scale modeling and simulation, and they were migrating to the cloud, but they did very innovative outreach to the community, which we're also very interested in. And they created this dynamic graphic novel to share on Twitter, and this was shared and distributed at the Latinx Chemistry Meeting, which is an international consortium of Latinx chemists working in this area, and that was awarded to a grant to NIGMS. Next slide. So the challenge of modern computing and NIH research. So the gist of this is that, as I've kind of alluded to in the examples that I showed you, NIH is organized in these institutes. There's 27, but there's 24 that issue grants. And these institutes really have grown up out of disease areas. So there's a very historical imprint to the organization of NIH. And that is worked well, except that for the abilities that are enabled by modern computing and modern data science, it does not always work as well as it could. And we're looking at what's becoming possible with computing. And what becomes possible is really spanning these traditional NIH boundaries. And so ODSS, as Susan was describing, really has the mission and the mandate to catalyze data science advances across NIH for this modern biodata ecosystem. But the scale and speed of change is just absolutely breathtaking. And so it's very exciting, but with the use of the cloud and AI, ML, and all that's involved in that, and large-scale knowledge graphs, and many things that are emerging, recently and quite rapidly. And so the gist of this slide is just to indicate that we understand that this challenge really requires us to work differently, and that many aspects of this are kind of deeply socio-technical, that have both important technical and social components. And a great example of that is, building ethics into AI ML. It's just one of many examples. But we know that we need to adopt and advance new technologies, and we know that we need to organize our communities differently. And that's why we are, that was the gist of the effort in the software supplements, is to just a very small but important step to organizing our communities differently and building new collaborations and reaching out more broadly, because we know this is going to be very important to us. And the illustration is just from a human genome exhibit that the Smithsonian sponsored. It was at actually in the Smithsonian Museum of Natural History for a couple of years in Washington, D.C., and then it went on a traveling roadshow. And this is just to indicate kind of the digital twin, concept where, we know that information is important and deeply embedded in our efforts to understand human health. Next slide. Okay, so I'll just summarize by, we've learned a lot from the supplement program. We've learned a lot of what we can do and the impacts it can have and the broad communities that need these types of efforts. And this is really, we've really built on that knowledge to develop new opportunities that are in process and just starting right now, basically. And Lori Scott Sheldon is going to tell you more about those. Next slide.
Great, thank you, Heidi. So this concept that Heidi just mentioned was really born out of this idea that, building sustainable software and tools really requires community building. Not only this building of the community of highly skilled research software engineers, but also this broader scientific community that really supports, recognizes, fosters, and values the substantial contributions of research software engineers, as well as the critical need for open source software for advancing science. So with this in mind, we recently proposed 2 initiatives during the January 2023 Council of Councils to support the building of sustainable foundations for open software and tools in the biomedical and behavioral sciences. These initiatives focused on 2 related areas. The first one is to pilot the new model to support research software engineers, and the second was to fund projects to foster software foundations to increase the robustness, reproducibility, and reusability of NIH-supported open software tools. Next slide, please. Thank you. So this first initiative supports exceptional research software engineers who are not often considered PIs, but thrive in an academic research environment where cutting-edge science can happen and who can make a long-lasting impact on NIH research projects. This award can also enhance the autonomy and the career continuity of these highly skilled research software engineers and support their ongoing efforts in the biomedical and behavioral sciences. Next slide, please. This second initiative will continue to build community by supporting projects to develop robust, shareable, and sustainable software and tools that are really critical for the reproducibility of biomedical and behavioral research findings. This opportunity will bring software development best practices and emerging technologies to NIH research projects, while also fostering those critical collaborations between the biomedical and behavioral scientists, as well as the software engineers that can extend the impact beyond our initial investments. Next slide, please. But most importantly, these efforts for building communities that support open software and tools are really critical for creating a modernized biomedical and behavioral data ecosystem that will catalyze advances in science. And as we move forward with these initiatives, I hope that you're just as excited as we are about our next steps for building community by supporting these sustainable software for open science. So next, I'm going to turn it over to Ishwar, who will discuss the preliminary details of these initiatives.
Thank you, Lori. So just to give you a little bit of an idea, these, as Lori mentioned, these initiatives, just the concept has been approved thus far, so details are not fully available yet. But just to give you an idea of what the draft requirements and expectations are, they are as follows. So for the Research Software Engineer Award, we essentially want to kind of make sure we have a good understanding of the project collaboration and the role that the RSE brings to the project. Be able to demonstrate software engineering experience, including software best practices and their adoption in the project, and that the applicant is a full-time, non-tenure track position, and the goal is to cover salary and travel only through this specifically dedicated RSE award. And of course, we would like to require letters of support and recommendation letters for the research software engineer. For the Sustainable Software Tools project, we basically want the application to describe the research project and the need to sustain the software, present robust software development plan, milestones and metrics associated with that, adopting best software engineering practices, include relevant research and engineering collaborations, as you know, Susan, Heidi, and Laurie have already kind of explain the underlying premise of building these collaborations, and last but certainly not the least, encourage open development practices right from the get-go of the project itself. And so this is just kind of a standard council slide that we kind of use for purposes, but I wanted to kind of throw this out there just to give you the new program initiative with the 2 potential funding opportunities that we hope will help advance open sustainable software mechanism, one focusing on the research software engineer, the other focusing on sustaining the software itself and increasing the longevity of the software through multiple use cases and applications across many different projects. This slide, of course, gives you more detail than the specificity of the mechanism, the duration of these awards, the budgetary aspects of what will be covered and what will not be covered, and kind of some overarching amounts that we have set aside for these 2 projects, about $6 million each for the first year. The way these, and I'll talk a little bit more about this, all of these programs work is we have 1 or more receipt dates for applications, depending on how the program is set up. These are reviewed by either standard study sections, and in this case, we have a special emphasis panel, given the unique nature of this program initiatives, that will review the applications. And of course, as always, we encourage applicants to kind of reach out to NIH and the appropriate program officers to seek consultation before you submit this. Letters of intent are optional to kind of give us a heads up on your project idea and objectives over there. Of course, the details of this presentation, council presentation, are available on the website, including the entire slide deck that was presented at the council. So at this point, I'll shift gears to kind of sharing a little bit for those of you who may or may not know a lot about NIH as a funding organization and resources over here. There's actually a wealth of information available on the Office of Extramurals Research website, where you can go navigate to grants.nih.gov. That provides an application guide on how to apply for grants, and which includes everything you need to know to prepare to apply for the complete application form, submit your application, and all the other associated details. More than you'd like to know. It also showcases the NIH guide for grants and contracts, which is basically our official publication that provides general information about all the available grants. And you can actually subscribe to this from the website, so that you get weekly notifications if you don't want to kind of navigate to it. And last but not, we have a set of tools that give you access to all the current portfolio that NIH provides, that will help you kind of not only explore the kinds of projects to identify if your project brings unique value or is kind of a exciting project that will fill a gap or a need, but it also gives you access to all the existing funded grantees to kind of identify new opportunities for collaboration. So there's several tools that you could explore over there. And then, of course, I think what might be interesting for everybody, even those that are veterans, is to understand the grant overview process. That, you know, if you're new to it, it's incredibly useful to understand the dynamics and the logistics of it, because it's not overnight. It does take several months to go through that cycle. And it also changes here and there a little bit. So it's good to kind of periodically go back and refer to it to understand that. Of course, NIH Office of Extramural Research has extensive webinars on each of these steps and processes, and this is only kind of the tip of the iceberg over here. So with that said, as Susan mentioned earlier, we want to acknowledge the contributions of not only the software working group members and over 140 NIH staff from across 26 ICs that are on all of the various implementation teams for NIH's strategic plan for data science over there. And would like to kind of open this up for this questions, of course, initially from all of you, and also a discussion question that we thought would be useful to put out there on the table as to what would it take to ensure, you know, research software engineers in the biomedical community are meaningfully engaged with each other to further accelerate and enhance sustainable software development. So with that, I'm going to kind of stop sharing my slides so I can actually see what's on the screen and who's there. So we'll open it up for questions in the meantime while I stop sharing screen.
Okay, well, thanks very much to all four of you. I think, yeah, I guess just from my point of view, just to start off, I was curious for links for different things that you were mentioning, and Lori shared one of them in chat, which was great. And then I was going to ask about links for the programs, and then you said that the programs aren't really there quite yet. So I think we'll be looking forward to seeing more details when they're available. Yeah, maybe we'll start with Pradeep, who had a comment in chat. And if anybody else wants to have a question or a comment, please put up your hand or put something in chat, and I'll call on you in order.
Yeah. Thank you, Daniel, and also to the RSC. I follow your newsletter, and I learned a lot of things, which is how I got to this event also. Just wanted to communicate to the ODSS officers and leaders here. From my experience, based on submitting software-focused grants, I feel like essentially like some of the reviewers in the summary statement told us, hey, we have textbooks and other small toolboxes. Why do we need software? I'm not hyping. That is exactly what they said. And I mean, it's possible that this person is probably somewhat behind and whatnot, but I think that there is a general tendency of, in the biomedical world especially, of not fully appreciating what it takes to really build good software and to maintain it, right? So sensitizing reviewers and like kind of elevating the baseline understanding of the difficulties in research software engineering and sustaining them, I think would really help. Right. And one another related thing is, in terms of making it useful for the community, I think a lot of the community involvement is very much driven by their own research needs, so to say. It's not like people are going to actively spend time, hey, we have this, let's try to do something. Most of the time, they're just trying to advance their own research goals. And if they find something that fits exact purpose and whatnot, they may use it, or they may not use it. Oftentimes what happens is they just go with developing in-house software rather than taking the time to actually build on existing open source grants. Two obvious reasons are, one, they don't have the time, and two, they don't have the incentive. It's actually sometimes more beneficial to do something new and publish a new paper on it, get credit for it. Actually, I'm sorry to put it in such a cynical way, but I've been doing this for like 7-8 years, and oftentimes we put out software after spending years, and then someone else, like from a big lab, does very similar things, put a new acronym to it, and these people, by the virtue of their reach and recognition, they get adopted. And I don't think the institutes are noticing it. So basically where I'm going with this is, in addition to sensitizing the reviewers, there has to be some sort of, hey, if you're asking for money to maintain something, for example, in terms of administrative supplements to existing awards for big PIs, etc., ask them to show us the literature, as in what's the ecosystem? Is there a really need to develop a new thing? How can we reuse most of the existing tools? How are you supporting ECRs in this process, etc.? I think that would go a long way to reduce the reinventing the wheel, and reducing the fragmented effort that goes nowhere, because people don't want to work on other people's projects. That's how most people see them, actually, unfortunately. So anyway, I don't want to take up all the time. Thank you.
We're very aware of the issues that you've raised in terms of the review, how applications are reviewed, how they're crafted in the first place. And so I don't think you've mentioned a single thing that we're not actually highly aware of. And that is actually the focus of a lot of our efforts, is to to pilot opportunities and to try to achieve changes and try to build kind of a more robust ecosystem. So I guess hopefully that's encouraging that we understand. I mean, for example, the software supplements. We've asked for things that don't typically get asked for in NIH awards. Things like really focusing on fundamental engineering design and trying to provide actual support for people to do good documentation, things that everybody knows are necessary and important. But if you don't, we understand that if you don't actually support and fund and foster these activities, that it just is very hard to actually bring to fruition.
No, and I would add to what Heidi said that we're acutely aware of the silos of the duplication of the same software, and it's been challenging equally for us to kind of break that cycle. Is precisely why we want to kind of look into adopting and fostering communities around, so people are aware of what's there and building on what's already out there rather than reinventing the wheel. And we also don't want software to be as I call disposable razor cartridges, that one software for one project and then it gets discarded, but as opposed to building a community around that and building on top of it so that others could reuse it and repurpose it and pivot it much more easily. And I think we have had some very good examples during COVID where certain software developed very specifically in certain communities were very quickly pivoted and very judiciously leveraged to be able to understand and use for other use cases and projects. So we want to kind of increase that, and that's exactly why we have the software sustainability, so that we can find ways to enhance the longevity of that software through multiple use cases. So thanks for reiterating those and sharing those and validating that for us as well from your point.
And I do think that Lori can speak to the idea of community, because we're also very focused on that. The idea that software communities, they can be self-organizing in ways that are fundamentally different, where sharing has a much different place, because people don't want to necessarily have to reinvent the wheel all the time. They do want reusability, and they want to be able to borrow what they need so that they can build what they're most interested in. And so Lori, I imagine that you could speak to this.
Yeah, I mean, I can talk a little bit about community and the importance of community and building that community so that we can sustain software and also, engage in a lot more collaboration, right, across the various institutes. What I think your name is correct?
Yes.
Yes. So I think what Predicta is really getting at is, this kind of need for like this cultural shift, right? This change, but change is really hard, even when we have the best of intentions. And so we have to persevere a little bit, right? And we have to continue to advocate for, the research software engineers, and to advocate for the need for this robust software that's sustainable and can be maintained over long periods of time. But it's hard, right? And it will take a group effort to do this.
Yeah, so sorry, quick comment about. Yeah, so like Lori was saying, we have to persevere. The problem is people like me who've been I'm an assistant professor at the University of Pittsburgh. To persevere, we need to demonstrate the ability to get grants to pay ourselves as well as our students and staff who actually do this, right? I haven't gotten a grant yet. I'm not complaining, but the point is, if all the money, even for software stuff, is going to the big PIs and not ECRs like us, we can't persevere. End of story. I think the best way to support communities is to distribute the money that goes towards this in much more, non-traditional ways, right? Our communities are sustained by PIs, as far as I understand. Money and support for RSEs is good and important and necessary, but also PIs are the ones that keep the connections and the community going, I think. So for a more, how do I call it, decentralized effort in maintaining software, we need to spread the money around, not just give supplements to people who already have big grants, in my opinion.
I think we all agree with you, Pradeep, that we do need to engage a larger community in software engineering, and this is exactly why we've gone through the process of getting these new 2 concepts that will be open to anybody who's interested in developing software for biomedical research and to support research engineering software. And the staff who do it, it's a new program, so it is a little bit of a trial, but it's a very big step for NIH to actually set up a program like this.
Yeah, and I would add, in the interim, I would encourage you to pursue some team science approaches. You know, for example, we at NIMH are encouraging that, where we're pairing people up, pairing, someone with subject domain expertise with people with, critical skills. And you can use that as an MPI approach. So it's one way to kind of leverage some of the, the work that we support, some of the opportunities that we have. While some of these other opportunities are being developed.
So Lee, are you in the same subject or a different subject? Because
different subject.
Okay, let me just make one quick comment then on this one before, and then you're next. The experience that I had at NSF, just going to Pradeep's question, is that it really took us a number of years to build up kind of expectations of the reviewers about how to review. Because what we were trying to do was so different than what NSF had done traditionally. And I felt like that actually involved having program officers in the panels that were maybe slightly more active than traditional in terms of helping guide discussion, let's say. So that might just be a comment for when you're actually doing these reviews, is that it may need you to be, well, not you, but it may need somebody there to be a little more active than just to let things go and to help make sure things stay on the path that you want them to.
Yeah, I think that's a great point, Dan. So for the new concept, we're working hard to get to enable a special emphasis panel where we can really reach out, help craft a panel of reviewers who would be well suited to understand, the real goals and intentions of the program. I think that will actually be critical to the success, and it is a key gatekeeper function, how the applications do in review. And anytime you're trying to do something truly innovative and so probably important, right? You face that challenge, and so we're going to do our best to address that.
Great, thanks, Lee.
So first of all, I wanted to thank all of you for giving your these presentations today. I think the programs that you're describing are going to be very useful, and I hope for a number of people on this call, fun to work on. To your question for discussion about what it'll take to create a meaningful engagements here. One of the challenges that I've observed in the research community at large, and this is true for people who work with NIH, for people who work with NSF or NASA or DOE, is sustaining their teams over the long term, because while you can do a lot with good software engineering practices to make the software survive a change of personnel, you lose a lot when you lose a person. And I've seen a number of colleagues who have had people funded on NIH projects, on NSF projects, lose those people because the funding was too short term and it was too hard to achieve what in our team sometimes we call dynamic stability, meaning that you always have enough things coming down the pipe that you can replace funding that is expiring. That's hard to do. And so I just wanted to note that as you're thinking about sustainability in this area, you might want to also consider that there are other sources of, that the teams that are going to truly retain a good staff of personnel may have to look beyond grant issuing organizations in order to sustain their teams and think of other ways to bring in revenue to support their teams that isn't 100% reliant on grant giving agencies like NIH, sorry, that I think generally have a hard time with really long-term funding. And so, you know, these programs all sound like they're going to be maybe 1, 2, 3, 4 year opportunities. You're not going to develop a sustainable team on a program like that. And so, you know, I hope that part of the program will be encouraging investigators and employers to consider how are you going to keep these people around in the long term.
That's a very intriguing point. It's kind of what we were hoping to get out of our conversation today is, you know, maybe ideas like that, you know, we hadn't necessarily encountered before. Do you have any examples? Like you mentioned other sources of funding besides grants. Of course, grants are kind of a soft money type of funding.
Yeah.
Do you have just any examples?
Yeah, so I mean, I think RSE as an organization is you know, has been exploring that, and so Dan could probably give us some comments on ways that that's been done in the open source area. My own team at the University of Chicago, Globus, we have done several iterations of this, and currently have had great success with a essentially user pays. It's not really user pays because we're a little bit different from that, but a freemium model where people who or organizations, institutions who rely on the software are encouraged to, in our case, subscribe to our service. And so, you know, we needed to actually change the software so that it was more service oriented and less you know, install and deploy the software yourself as an organization, but instead, you know, make it service oriented so that we could have something that gave people a way to contribute to it. But there are definitely ways of doing that in the open source world as well. And so I would, you know, I think we could encourage software engineering teams who get awards through this program to explore, you know, over the course of the project, how can you transition to another model that will sustain your funding as long as the software is being used by the community.
This is very intriguing, and I just want to ask, is there like a US-RSE resource, or is this knowledge distilled yet in a way that could be transferred to us? Because I think this is an example of exactly what we're looking for, is to understand these other models and to find ways to bring them into the equation.
So I usually rely on Dan as my my Yoda on that topic. So Dan, do you have anything to say?
I don't know that I have a whole lot to say in general. I can sorry, let me I can share one thing that's that I worked on with a bunch of other people at some point, which is just kind of a set of different models for how projects can be funded over time. But the thing that I would say actually that I've really liked and I've seen happen elsewhere was EPSRC in the UK. Did some funding for RSEs where they funded new RSEs at universities for some period of time. I think it was 2 years, where the universities basically committed to keep funding them after that for another 2 years or something like that. And by that time, the institution generally figures out how useful those people are and then finds a way to keep them. So I think if there's something that NIH could do to kind of to catalyze institutions to hire people and to pay for them at least part of their time through their own funds, that would be great. And again, EPSRC, I think, was an example of doing that in the UK.
I would be very interested. Yeah, I would be interested, Dan, in that conversation, because, you know, we're committed to this across NIH, but it's going to not be a very large amount of money. And so I'm worried that the impact may be smaller than what we hope. And so we need to leverage and work across different funding agencies and also across this organization.
Right. I'll paste the EPSRC call that was from a few years ago now. I'm not an expert at this by any means, but we could put you in touch with the people that are there if you don't know them.
Yeah, that would be great.
Andy?
Different direction. I work on a number of web services and we try to leverage the cloud. But we've been gun shy about some ideas for fear that if we have an idea, say a year before the end of the grant, then as soon as the grant ends, the cloud funding goes away and the entire service does. Do you have any thoughts on how to fund useful web services that right now we can't pay up front? And so we end up cutting off some potential ideas or directions. Like I said, just for fear that the minute that we stop paying the bills, the whole service disappears. Oh, this hands up.
Yeah. I can certainly take a stab and interested in my colleagues, but there are a few activities that we've been starting to deploy or develop. Certainly, we've been leveraging GitHub as a way to sort of socially share code and platforms. Another activity that we've stood up that is not quite completely launched, but is close-ish, is our Cloud Lab, where we're collecting different software and modules that will be in the Cloud Lab for researchers to use in perpetuity. It is all cloud-based and it's on both Google and AWS, but it's not completely deployed on Google right now. There's got to be other, bioconductor and other software communities that certainly would be a more sustainable effort as you're thinking about what happens when you deploy something on the cloud. And then, as you know, cloud is a pay-as-you-go, and so that has its own certain risk.
Yeah. I mean, even if we could prepay a year or two in advance, so we'd guarantee some runway for the project.
Yeah, at NIH you can do it, but I just don't know in general, but we have set up the mechanism for NIH grantees to do that.
Oh, really?
Yep.
That's very interesting. Thank you.
I think I want to say add something to that, Suzanne. And basically, we at OHSL Open Health Systems Lab are really working on this kind of a model, but working it from a private-public partnership part of it, saying, okay, can we create a sustainable subscription model and bring a certain amount of investment in front, saying that, okay, the private sector will benefit if it becomes a prevalent model. They benefit by providing infrastructure and services. So we are exporting in two different areas on that model. The issue basically, basically is there's a gray space between the grantees of NIH and people outside the grant who are not a grantee of NIH at the moment. And is there a mechanism that we can create those kind of collaborations and cooperation there? Like, for example, Strides is a very good example of it. That, okay, Strides has created this platform and a lot of learning. Now, if you can include more people from outside NIH, grantees of NIH, who are potential grantees and potential collaborators, I think that will do a lot of sharing of the knowledge will be very useful in that domain and generate the synergy that you need to make this viable thing. So I think there's a tremendous amount of resources that are there. A lot of investment has come from tax dollars over the years, and it can be utilized to build a more robust knowledge system for biomedical research. So I definitely think there could be a lot of innovative ways of looking at it if we can just go across the boundaries of a government and non-government kind of situation at this moment in time.
Thank you. That's a great thought. I agree.
Okay, so we have a couple minutes left. If there's any final either short question or short comment that anyone has that they think would either the NIH folks can answer or would benefit from learning something new.
Is there going to be a special software-focused study section? I think that might be good.
We do have MABS and BDMA. MABS is the closest to software. at NIH. But as Ishwar said, there will be a special emphasis panel for the programs that we're setting up because they're quite unique at NIH.
Dave.
Just really quick, thank you for coming, and I'm really excited about both the RSE and the community sort of funding mechanisms that you talked about. I just wanted to echo the point that Lee made, I think, about like I would love to see like some sort of, you know, you have like the senior research scientist like K awards, something like that to support like long-term, so that you could have you know, an RSE stay with a project. And then to Pradeep's point about like another sort of concern, like these mechanisms seems great, but I can imagine like a funding panel being like, oh, this isn't for this disease. But like you said, right, like we're realizing that a lot of these tools are like across domains. So just like echoing that point that I don't know how you make that work with the study sections, but like sort of like emphasizing that these tools are useful across domains. So,
and I think that's something that's really important for you to emphasize too in any future grant application, really how this, you know, any software that you're building, right, can be used across a number of domains. And I think that makes it very attractive, right, relative to something that may be very domain specific and can't, you know, go beyond a specific project.
Got it. Good to hear. Thank you.
Okay, well, I think with that, we'll wrap up. As I just put in the chat, thanks very much to the 4 NIH speakers and to all of the attendees. The next talk that we're going to have in the series is going to be from the Chan Zuckerberg Initiative from Carly Strasser on May 9th. And then we'll be having a talk from NSF coming in late June after that. Again, thanks very much, everybody. Hope to see you back at the next session. And Susan, I'm assuming that you will not have any problem with us sharing these slides in the video, at least of the talking part. Hopefully not, and if not, we'll put those up as soon as we can.
Oh yeah, no concerns. This is all public, based on a public presentation to our councils. Okay, very good. So if you registered for this, then you should get an email when everything is up saying that the materials are up. So thanks very much, and see everybody hopefully in another few weeks, 6 weeks.
Thank you for having us.
Thank you.
Yep.